Next evening, prim and nervous side in a rear seat of the Crosstown bus, Esther divided her attention between the delinquent wilderness outside and a paperback copy of The Search for Brady Murphy. This book had been written by a Colorado businessman to tell people there was life after death. In its course he touched upon metempsychosis, faith healing, extrasensory perception and the rest of a weird canon of 20th century metaphysics we've come now to associate with the city of Los Angeles and similar regions. The bus driver was of the normal or placid crosstown type, having fewer traffic lights and stops to cope with than the up and downtown drivers. He could afford to be genial. A portable radio hung by his steering wheel, tuned to WQXR. Tchaikovsky's Romeo and Juliet overture flowed syrupy around him and his passengers. As the bus crossed Columbus Avenue, a faceless delinquent heaved a rock at it. Cries in Spanish ascended to it out of the darkness. A report which could have been either a backfire or a gunshot sounded a few blocks downtown. Captured in the score's black cymbals, given life by vibrating air columns and strings, having taken passage through transducers, coils, capacitors and tubes to a shuddering paper cone, the eternal drama of love and death continued to unfold entirely disconnected from this evening in place. The bus entered the sudden waste country of Central Park. Out there, I knew, up and downtown, they would be going at it under bushes. Mugging, raping, killing. My world knew nothing of the square confines of the park after sundown. It was reserved as if by covenant for cops, delinquents and all manner of deviants. Suppose I were telepathic, and could tune in on what was going on out there. I preferred not to think about it. There would be power in telepathy, I thought, but much pain. And someone else might tap your own mind without your knowing. Had Rachel been listening on the phone extension? I touched the tip of my new nose delicately, in secret, a mannerism I developed just recently. Not so much to point it out to whoever might be watching as to make sure it was still there. The bus came out of the park onto the safe, bright east side, into the lights of Fifth Avenue. They reminded me to go shopping tomorrow for a dress I'd seen, $39.95 at Lord & Taylor, which he would like. What a brave girl I am, I trilled to myself, coming through so much night and lawlessness to visit my lover. I got off at First Avenue and tapped along the sidewalk, facing uptown and perhaps some dream. Soon I turned right, began to fish in my purse for a key. Found the door, opened, stepped inside. The front rooms were all deserted. Beneath the mirror, two golden imps in a clock danced the same unsyncopated tango they'd always danced. I felt home. Behind the operating room, a sentimental glance sideways through the open door toward the table on which my face had been altered, was a small chamber, in it a bed. He lay, head and shoulders circled by the intense halo of a paraboloid reading light. His eyes opened to me, my arms to him.
You are early.
I am late, she answered, already stepping out of her skirt. Shawi Maker, being conservative, referred to his profession as the art of tagliacosi. His own methods, while not as primitive as those of the 16th century Italian, were marked by a certain sentimental inertia, so that Shawi Maker was never quite up to date. He went out of his way to cultivate a tagliacosi look, showing his eyebrows thin and semicircular, wearing a bushy mustache, pointed beard, sometimes even a skull cap, his old schoolboy yarmulke. He'd received his impetus, like the racket itself, from the World War.
At 17, coeval with the century, I raised the mustache, which I never shaved off, falsified my age and name, and wallowed off in a fetid troopship to fly. So I thought, high over the ruined chateau and scarred fields of France, got up like an earless raccoon to scrimmage with the Hun. A brave Icarus. Well, the kid never did get up in the air, but they made me a greasy monkey, which was more than I'd expected anyway. It was enough. I got to know the guts not only of Brigates, Bristol fighters and JNs, but also of the birdmen who did go up, and who, of course, I adored. There was always a certain feudal homosexual element in this division of labor. I felt like a page boy. Since those days, as we know, democracy has made its inroads, and those crude flying machines have evolved into weapon systems of then undreamed of complexity. So that the maintenance man today has to be as professional and noble as the flight crew he supports. But then, it was a pure and abstract passion, directed for me, at least, toward the face. My own mustache may have been partly responsible. I was often mistaken for a pilot. On off hours, infrequently, I would sport a silk kerchief obtained in Paris at my throat, by way of imitation. The war being what it was, certain of the faces, craggy or smooth, with slick down hair or bald, never came back. To this the young Shawty maker responded with all adolescent love's flexibility, my free-floating affection sat thwarted for a time till it managed to attach itself to a new face. But in each case, loss was as unspecified as the proposition love dies. They flew off and were swallowed in the sky, until Evan Godolphin, a liaison officer in his middle 30s, due with the Americans for reconnaissance missions over the Argonne Plateau, Godolphin carried the natural foppishness of the early aviators to extremes which in the time's hysterical context seemed perfectly normal. Here were no trenches, after all, the air up there was free of any taint of gas or comrades' decay. Combatants on both sides could afford to break champagne glasses in the majestic fireplaces of commandeered country seats, treat their captives with utmost courtesy, adhere to every point of the duello when it came to a dogfight. In short, practice with finicking care the entire rigmarole of 19th century gentlemen of war.
I wore a Bond Street tailored flying suit. Would often, dashing clumsily across the scars of their makeshift airfield toward his French Spad, stop to pluck a lone puppy, survivor of strafing by autumn and the Germans. Naturally aware of the Flanders Fields poem in Punch, 3 years ago when there had still been an idealistic tinge to trench warfare, and inserted into one faultless lapel. I became Schellingmaker's hero. Tokens tossed his way, an occasional salute, a well done, for the pre-flights which came to be the boy mechanic's responsibility, a tense smile, were hoarded fervently. Perhaps he saw an end also to this unrequited love. Doesn't a latent sense of death always heighten the pleasure of such an involvement? The end came soon enough.
One rainy afternoon toward the end of the Battle of Meuse-Argonne, Godolphin's crippled plane materialized suddenly out of all that gray, looped feebly, dipped on the wing toward the ground, and slid like a kite in an air current toward the runway. It missed the runway by 100 yards. By the time it impacted, corpsmen and stretcher-bearers were already running out toward it. I happened to be nearby and tagged along, having no idea what had happened till I saw the heap of rags and splinters, already soggy in the rain, and from it, limping toward the medics, the worst possible travesty of a human face lolling atop an animate corpse. The top of the nose had been shot away. Shrapnel had torn out part of one cheek and shattered half the chin. The eyes, intact, showed nothing. I must have lost myself. The next I could remember, I was back at an aid station, trying to convince the doctors there to take my own cartilage. Godolphin would live, they'd decided. But his face would have to be rebuilt. Life for the young officer would be, otherwise, unthinkable. Now luckily for some, a law of supply and demand had been at work in the field of plastic surgery. Godolphin's case, in 1918, was hardly unique. Methods had been in existence since the 5th century BC for rebuilding noses. Thiersch grafts had been around for 40 or so years. During the war, techniques were developed by necessity and were practiced by GPs, ear, nose and throat men, even a hastily recruited gynecologist or two. The techniques that worked were adopted and passed on quickly to the younger medics. Those that failed produced a generation of freaks and pariahs, who along with those who had received no restorative surgery at all became a secret and horrible post-war fraternity. No good at all in any of the usual rungs of society. Where did they go?
Profane would see some of them under the street. Others you could meet at any rural crossroads in America. As Profane had come to a new road, right angles to his progress, smelled the diesel exhaust of a truck long gone like walking through a ghost, and seen there like a milestone one of them,
whose limp might mean a brocader's relief of scar tissue down one leg. How many women had looked in shock? Whose cicatrix on the throat would be hidden modestly like a gaudy war decoration? Whose tongue, protruding through a hole in the cheek, would never speak secret words with any extra mouth? I proved to be one of them. The doctor was young, he had ideas of his own, which DF was no place for. His name was Halidum, and he favored allografts, the introduction of inert substances into the living face. It was suspected at the time that the only safe transplants to use were cartilage or skin from the patient's own body. Shaheen Maker, knowing nothing about medicine, offered his cartilage, but the gift was rejected. Allografting was plausible, and Halidum saw no reason for two men being hospitalized when only one had to be.
Thus Godolphin received a nose bridge of ivory, a cheekbone of silver, and a paraffin and celluloid chin. A month later, Shaheen Maker went to visit him in the hospital, the last time he ever saw Godolphin. The reconstruction had been perfect. He was being sent back to London, in some obscure staff position, and spoke with a grim flippancy.
Take a long look. It won't be good for more than 6 months.
I stammered. Godolphin continued.
See him, down the way? 2 cots overlay what would have been a similar casualty, except that the skin of the face was whole, shiny. But the skull beneath was misshapen. Foreign body reaction, they call it. Sometimes infection, inflammation, sometimes only pain. The paraffin, for instance, doesn't hold shape. Before you know it, you're back where you started.
He talked like a man under death sentence.
Perhaps I could pawn my cheekbone. It's worth a fortune. Before they melted it down, it was one of a set of pastoral figurines, 18th century, nymphs, shepherdesses, looted from a chateau the Hun was using for a CP. Lord knows where they're originally from. Couldn't my throat was dry, couldn't they fix it, somehow, start over? Too rushed. I'm lucky to get what I got. I can't complain. Think of the doubles who haven't even 6 months to bash around in.
What will you do when
I'm not thinking of that. But it will be a grand 6 months.
The young mechanic stayed in a kind of emotional limbo for weeks. He worked without the usual slacking off, believing himself no more animate than the spanners and screwdrivers he handled. When there were passes to be had, he gave his to someone else. He slept on an average of 4 hours a night. This mineral period ended by an accidental meeting with a medical officer one evening in the barracks. Shaheen Maker put it as primitively as he felt.
How can I become a doctor?
Of course it was idealistic and uncomplex. He wanted only to do something for men like Godolphin, to help prevent a takeover of the profession by its unnatural and traitorous Halidums.
It took 10 years of working at his first specialty, mechanic, as well as navy in a score of markets and warehouses, bill collector, once administrative assistant to a bootlegging syndicate operating out of Decatur, Illinois. These years of labor were interlarded with night courses and occasional day enrollments, though not more than 3 semesters in a row after Decatur, when he could afford it. Internship. Finally, on the eve of the Great Depression, entrance to the medical Freemasonry. If alignment with the inanimate is the mark of a bad guy, Shaheen Maker at least made a sympathetic beginning. But at some point along his way there occurred a shift in outlook.
So settled that even Profane, who was unusually sensitive that way, probably couldn't have detected it. He was kept going by hatred for Halidum and perhaps a fading love for Godolphin. These had given rise to what is called a sense of mission, something so tenuous it has to be fed more solid fare than either hatred or love. So it came to be sustained, plausibly enough, by a number of bloodless theories about the idea of the plastic surgeon.
Having heard his vocation on the embattled wind, my dedication was toward repairing the havoc wrought by agencies outside my own sphere of responsibility. Others, politicians and machines, carried on wars. Others, perhaps human machines, condemned his patients to the ravages of acquired syphilis. Others, on the highways, in the factories, undid the work of nature with automobiles, milling machines, other instruments of civilian disfigurement. What could I do toward eliminating the causes?
They existed, formed a body of things as they are. He came to be afflicted with a conservative laziness. It was social awareness of a sort, but with boundaries and interfaces which made it less than the Catholic rage filling him at night in the barracks with the MO. It was in short a deterioration of purpose, a decay. Oddly enough, through Stencil, who at the time was only a newcomer to the crew. Stencil, pursuing a different trail, happened for reasons of his own to be interested in Evan Godolphin's history. He'd followed it as far as Musargon.
Daving finally got Schoenmaker's alias from the AEF records. It took Stencil months to trace him to Germantown and the Muzak-filled Face Hospital. The good doctor denied everything. After every variety of cajolement, Stencil knew it was another dead end. As is usual after certain frustrations, we react with benevolence. You had been languishing ripe and hot-eyed about the rusty spoon, hating your figure 6 nose, and proving as well as you could the unhappy undergraduate adage.
All the ugly ones fuck.
The thwarted Stencil, casting about for somebody to take it all out on, glommed onto your despair hopefully, a taking which progressed to sad summer afternoons wandering among parched fountains, sunstruck shop fronts and streets bleeding tar, eventually to a father-daughter agreement casual enough to be cancelled at any time should either of them desire, no post-mortems necessary. It struck him with a fine irony that the nicest sentimental trinket for you would be an introduction to Schoenmaker. Accordingly, in September, the contact was made and without ado you went unto his knives and kneading fingers.
Collected for her in the anteroom that day were a rogue's gallery of malformed. A bald woman without ears contemplated the golden clock, skin flesh and shiny from temples to occiput. Beside me sat a younger girl, whose skull was fissured such that 3 separate peaks, paraboloid in shape, protruded above the hair, which continued down either side of a densely actined face like a skipper's beard. Across the room, studying a copy of the Reader's Digest, sat an aged gentleman in a moss-green gabardine suit, who possessed 3 nostrils, no upper lip and an assortment of different-sized teeth which leaned and crowded together like the headstones of a boneyard and tornado country. And off in a corner, looking at nothing, was a sexless being with hereditary syphilis, whose bones had acquired lesions and had partially collapsed so that the gray face's profile was nearly a straight line, the nose hanging down like a loose flap of skin, nearly covering the mouth, the chin depressed at the side by a large sunken crater containing radial skin wrinkles, the eyes squeezed shut by the same unnatural gravity that flattened the rest of the profile. I, who was still at an impressionable age, identified with them all. It was confirmation of this alien feeling which had driven me to bed with so many of the whole sick crew. This first day Schoenmaker spent in preoperative reconnaissance of the terrain, photographing my face and nose from various angles, checking for upper respiratory infections, running a Wassermann. Irving and Trench also assisted him in making 2 duplicate casts or death masks.
They gave her 2 paper straws to breathe through, and in her childish way she thought of soda shops, cherry cokes, true confessions. Next day she was back at the ones. The 2 casts were there on my desk, side by side.
I'm twins, she giggled. Schoenmaker reached out and snapped the plaster nose from one of the masks.
Now.
He smiled, producing like a magician a lump of modeling clay with which he replaced the broken-off nose.
What sort of nose did you have in mind? What else? Irish, she wanted, turned up. Like they all wanted. To none of them did it occur that the Red Roost nose too is an aesthetic misfit, a Jew nose in reverse, is all. Few had ever asked for a so-called perfect nose, where the roof is straight, the tip untilted and unhooked, the columella separating the nostrils, meeting the upper lip at 90 degrees. All of which went to support my private thesis that correction, along all dimensions, social, political, emotional, entails a retreat to a diametric opposite rather than any reasonable search for a golden mean. A few artistic finger flourishes and wrist twistings. Would that be it?
Eyes aglow, she nodded.
It has to harmonize with the rest of your face, you see. It didn't, of course. All that could harmonize with a face, if you were going to be humanistic about it, was obviously what the face was born with. But, I'd been able to rationalize years before, there is harmony in harmony. So, Esther's nose. Identical with an ideal of nasal beauty established by movies, advertisements, magazine illustrations. Cultural harmony, I called it. Try next week then. I gave her the time. Esther was thrilled. It was like waiting to be born, and talking over with God, calm and businesslike, exactly how you wanted to enter the world. Next week she arrived, punctual, guts tight, skin sensitive. Come.
Maker took me gently by the hand. I felt passive, even a little sexually aroused. I was seated in a dentist's chair, tilted back and prepared by Irving, who hovered about me like a handmaiden.
Esther's face was cleaned in the nasal region with green soap, iodine and alcohol. The hair inside her nostrils was clipped and the vestibules cleaned gently with antiseptics. She was then given Nembutal. It was expected this would calm her down, but barbiturate acid derivatives affect individuals differently.
Perhaps my initial sexual arousal contributed, but by the time I was taken to the operating room I was near delirium.
Should have used Hyoscine.
Trench said.
It gives them amnesia, man. Quiet, schlep,
said the doctor, scrubbing. Irving set about arranging his armamentarium, while Trench strapped Esther to the operating table. Esther's eyes were wild. She sobbed quietly, obviously beginning to get second thoughts.
Too late now?
Trench consoled her, grinning.
Lay quiet, hey.
All three wore surgical masks. The eyes looked suddenly malevolent to Esther. She tossed her head.
Trench, hold her head,
came Maker's muffled voice.
And Irving can be the anesthetist. You need practice, babe. Go get the Novocaine bottle. Sterile towels were placed under Esther's head and a drop of castor oil in each eye. Her face was again swabbed, this time with methamphetamine and alcohol. Gauze packing was then jammed far up her nostrils to keep antiseptics and blood from flowing down her pharynx and throat. Irving returned with the Novocaine, a syringe, and a needle. First she put the anesthetic into the tip of Esther's nose. 1 injection on each side.
Next I made a number of injections radially around each nostril, to deaden the wings, or ally, my thumb going down on the plunger each time as the needle withdrew.
Switch to the big one.
Maker said quietly. I fished a 2-inch needle out of the autoclave.
This time the needle was pushed, just under the skin, all the way up each side of the nose, from the nostril to where the nose joined forehead. No one had told Esther that anything about the operation would hurt.
But these injections hurt. Nothing before in my experience had ever hurt quite so much. All I had free to move for the pain were my hips. Trench held my head and leered appreciatively as I squirmed, constrained, on the table.
Inside the nose again with another burden of anesthetic, Irving's hypodermic was inserted between the upper and lower cartilage and pushed all the way up to the glabella, the bump between the eyebrows.
A series of internal injections to the septum, the wall of bone and cartilage which separates the two halves of the nose, and anesthesia was complete. The sexual metaphor in all this wasn't lost on Trench, who kept chanting.
Stick it in. Pull it out. Stick it in. Ooh, that was good. Pull it out.
And tittering softly above Esther's eyes. Irving would sigh each time, exasperated. That boy, you expected her to say.
After a while Maker started pinching and twisting Esther's nose.
How does it feel? Hurt? I whispered no. Maker twisted harder. Hurt? No. Okay. Cover her eyes. Maybe she wants to look. You want to look, Esther? See what we're going to do you?
I don't know.
Her voice was weak, teetering between her and hysteria. Watch. Then, get an education. First we'll cut out the hump. Let's see a scalpel.
It was a routine operation. Maker worked quickly, neither he nor his nurse wasting any motion. Caressing sponge strokes made it nearly bloodless. Occasionally a trickle would elude him and get halfway to the towels before caught it.
I first made 2 incisions, one on either side through the internal lining of the nose, near the septum at the lower border of the side cartilage. I then pushed the pair of long-handled, curved and pointed scissors through the nostril, up past the cartilage to the nasal bone. The scissors had been designed to cut both on opening and closing. Quickly, like a barber finishing up a high-tipping head, I separated the bone from the membrane and skin over it. Undermining, we call this, I explained. I repeated the scissors work through the other nostril. You see you have two nasal bones, they're separated by your septum. At the bottom they're each attached to a piece of lateral cartilage. I'm undermining you all the way from this attachment where the nasal bones join the forehead. Irving passed me a chisel-like instrument. McKenty's elevator, this is. With the elevator I probed around, completing the undermining. Now, gently, like a lover, I'm going to saw off your hump.
Esther watched his eyes as best she could, looking for something human there. Never had she felt so helpless. Later she would say, it was almost a mystic experience. What religion is it? One of the Eastern ones, where the highest condition we can attain is that of an object, a rock. It was like that? I felt myself drifting down, this delicious loss of Estherhood, becoming more and more a blob, with no worries. Traumas, nothing, only being. The mask with the clay nose lay on a small table nearby. Referring to it with quick side glances,
Shawty-maker inserted the saw blade through one of the incisions he'd made, and pushed it up to the bony part. Then lined it up with a line of the new nose roof, and carefully began to saw through the nasal bone on that side. Now comes the tricky part. I got to saw off the other side exactly the same. Otherwise your nose will be lopsided. He inserted the saw in the same way on the other side, studied the mask for what seemed to Esther a quarter of an hour, made several minute adjustments. Then finally sawed off the bone there in a straight line. Your hump is now two loose pieces of bone, attached only to the septum. We have to cut that through, flush with the other two cuts.
This he did with an angle-bladed pull knife, cutting down swiftly, completing the phase with some graceful sponge flourishing. And now the hump floats inside the nose. He pulled back one nostril with a retractor, inserted a pair of forceps and fished around for the hump.
Take that back, he smiled. It doesn't want to come just yet. With scissors he snipped the hump loose from the lateral cartilage which had been holding it. Then, with the bone forceps, removed a dark-colored lump of gristle, which he waved triumphantly before Esther.
A quick transfer of calipers from mask to exposed septum. Then with a pair of straight scissors Shawty-maker snipped off a triangular wedge of septum.
22 years of social unhappiness, Nick Dwyer? End of Act 1. We'll put it in formaldehyde. You can keep it for a souvenir if you wish.
As he talked he smoothed the edges of the cuts with a small rasp file. So much for the hump. But where the hump had been was now a flat area. The bridge of the nose had been too wide to begin with, and now had to be narrowed. Again he undermined the nasal bones, this time around to where they met the cheekbones, and beyond. As he removed the scissors he inserted a right-angled saw in its place.
Your nasal bones are anchored firmly, you see, at the side to the cheekbone, at the top to the forehead. We must fracture them, so we can move your nose around. Just like that lump of clay.
He sawed through the nasal bones on each side, separating them from the cheekbones. He then took a chisel and inserted it through one nostril, pushing it as high as he could, until it touched bone. Let me know if you feel anything. He gave the chisel a few light taps with a mallet, stopped, puzzled, and then began to hammer harder.
It's a rough mother,
he said, dropping his jocular tone. Tap, tap, tap.
Come on, you bastard.
The chisel point edged its way, millimeter by millimeter, between Esther's eyebrows.
Shice.
With a loud snap, my nose was broken free of the forehead. By pushing in from either side with his thumbs, Shawty-maker completed the fracture.
See? It's all wobbly now. That's Act 2. Now we shortened that septum, yeah.
With a scalpel he made an incision around the septum, between it and its two adjoining lateral cartilages. He then cut down around the front of the septum to the spine, located just inside the nostrils at the back.
Which should give you a free-floating septum. We used scissors to finish the job.
With dissecting scissors he undermined the septum along its sides and up over the bones as far as the glabella, at the top of the nose. He passed a scalpel next into one of the incisions just inside the nostril and out the other, and worked the cutting edge around until the septum was separated at the bottom. Then elevated one nostril with a retractor, reached in with Alps clamps and pulled out part of the loose septum.
Now to put everything in place.
Keeping one eye on the mask, he brought together the nasal bones. This narrowed the bridge and eliminated the flat part where the hump had been cut off. He took some time making sure the two halves were lined up dead center. The bones made a curious crackling sound as he moved them.
For your turned-up nose, we make 2 sutures.
The seam was between the recently cut edge of the septum and the columella.
With needle and needle holder, 2 silk stitches were taken obliquely, through the entire widths of columella and septum. The operation had taken, in all, less than an hour. They cleaned Esther up, removed the plain gauze packing and replaced it with sulfur ointment and more gauze.
A strip of adhesive tape went on over my nostrils, another over the bridge of the new nose. On top of this went a stent mold, a tin guard, and more adhesive plaster. Rubber tubes were put in each nostril so I could breathe. 2 days later the packing was removed. The adhesive plaster came off after 5 days. The sutures came out after 7. The up-tilted end product looked ridiculous, but Xiaoyin Maker assured me it would come down a little after a few months. It did. Have been all, except for Esther. Possibly her old hump-nosed habits had continued on by virtue of momentum. But never before had she been so passive with any male.
Passivity having only one meaning for her, Esther left the hospital I had sent her to after a day and a night, and roamed the east side in fugue, scaring people with her white beak and a certain shock about the eyes.
I was sexually turned on, was all, as if you had located and flipped a secret switch or clitoris somewhere inside my nasal cavity. A cavity is a cavity, after all. Trench's gift for metaphor might have been contagious.
Returning the following week to have the stitches removed, you crossed in and crossed your legs, batted eyelashes, talked soft, everything crude you knew. I had spotted you at the outset as an easy make. Come back tomorrow, Irving was off. You arrived the next day garbed underneath his lassily and with as many fetishes as you could afford. There might even have been a dab of Shalimar on the gauze in the center of your face in the back room. How do you feel?
She laughed, too loud. It hurts. But.
Yes, but. There are ways to forget the pain. She seemed unable to get rid of a silly, half-apologetic smile. It stretched her face, adding to the pain in her nose. Do you know what we're going to do? Know what I am going to do to you? Of course. She let me undress her. I commented only on a black garter belt.
Oh. Oh God. An attack of conscience. Slab had given it to her. With love, presumably.
Stop. Stop the peep show routine. You're not a virgin.
Another self-deprecating laugh. That's just it. Another boy. Gave it to me. Boy that I loved.
She's in shock, I thought, vaguely surprised. Come. We'll make believe it's your operation. You enjoyed your operation, didn't you? Through a crack in the curtains opposite Trench looked on. Lie on the bed. That will be our operating table. You are to get an intermuscular injection.
No, I cried.
You have worked on many ways of saying no. No meaning yes. That no I don't like. Say it different.
With a little moan.
Different. Again.
No. This time a smile, eyelids at half-mast.
Again.
No.
You're getting better.
Unknotting his tie, trousers in a puddle about his feet, Xiaoyin Maker serenaded me.
Have I told you, fella, she's got the sweetest columella in the septum that swept them all on their ass. Each casual contractomy meant only a big fat check to me till I saw this osteoclastical lass. Till you've cut into Esther, you've cut nothing at all. She's one of the best. Third, to her nose I'm in crawl. She never acts nasty but lies still as a rock. She loves my rhinoplasty but the others are schlock.
Esther is passive, her plum is massive, how could any poor ass have ever passed her by? And let me do you say she puts Ireland to shame? for her nose is retros and Esther's her name. For the last 8 bars I chanted no on 1 and 3. Such was the, as it were, Jacobean etiology of my eventual trip to Cuba. Which see.
Because I love her, yes I do. And the kids we have, we know for sure they're gonna all get nose jobs too. She got a nose job, she got a nose job. It's now turned up instead of hanging down. She got a nose job, she got a nose job. And now she's the prettiest gal in town. Now she's the prettiest gal in town.